It's natural to think of menstrual health as a health issue, and it is that first and foremost. But it goes much beyond that, especially when there are barriers to menstrual health. For example, let's think about the education setting. In schools, if a girl doesn't have access to menstrual absorbents during her period, she may stay home some days. If she doesn't know how to plan for her period, she might have an accident in class. She might feel humiliated. She will stain through her clothes. And this happens more often than we think. There's now very good research, mainly in India, that shows that access to disposable sanitary pads increases school attendance and retention for girls. And something as cheap and as simple as menstrual pads has a measurable impact in girls' trajectories. Also, if we think of the workplace, it's a little bit the same intuition. Here, there's still a lot of research needed, but if we think about workplaces in low-income settings, because menstruation is such a unspoken topic, a lot of them, they're not prepared for it. So you don't have maybe a space to change, or you don't have the bins where to dispose of your products. There's no flexibility on asking to manage discomfort or asking for a break. If this becomes unmanageable, some women might stay at home as well, or might not join those workplaces, at least during those days that they're in their period. And I think what's important here is what is interesting is that as long as access can be solved, or as long as stigma plays a role, there's a solution that we can think of and change things.